Start.
Hello, this is Saida. I am Dr.
Yes,
Can you
doctor.
tell me about your problem?
Doctor, my legs, doctor, it was really painful. Sometimes I can't sleep.
Can you tell me a bit detail about your leg problem?
Well, doctor, it started 5 years ago. First in my hands. My hands become painful, and then they turn out to be white, and then they turn out to be red, and after a while it goes away. And this time it's my legs, but this time is much painful, and rather than becoming red, it's more purple or blue.
Mhm. For how long this problem has been started about your
This,
foot?
yeah, my foot just started few months ago,
Okay, so about how
just
during this period,
like two
how is it
months,
going?
like two
This
months, doctor.
is it increasing, decreasing, or the same?
Well, it's doctor, it's the same. It's not doing any better. Always comes at night.
Okay, which area exactly?
It's right here, doctor. Can you take a look at my leg? The tip of toes.
Okay, uh, mm, this is Saida. Can you tell me what make it better?
Sometimes when I put some blankets under my over my legs, sometimes it gets better.
And what make it worse?
Most likely I wake up at night when my blanket are uncovered from my leg. I feel much pain.
Okay. So, do you have such problem? I mean, this pain over your tip of nose or ears?
No, no,
Okay. Mrs. Khan, do you have any joint problem? Any pain in the joints?
no,
Do you have any rash on any part of the body?
no.
Okay. About 5 years, this problem has been started, huh?
It
Have you
started
seen by any doctor?
5 years ago in my hand, and just 1 month ago it started in my foot. My hand got better, but my foot now is the one causing me problem.
Okay. Mrs. Khan, Mrs. Saida, do you have any health problem like high blood pressure,
No,
high blood sugar,
no,
bothered by cold weather?
no. This actually this my leg is causing. It's become worse with cold weather.
Okay. Anyone in your family have the similar problem?
Yes, my aunt. My aunt has this similar problem, but it's not affecting sleep like this. It's just the
Mm.
color that what makes her concerned.
Okay. Mrs. Saida, what do you do for living?
I'm a secretary in international company.
How are the things? Is there any stress with your job?
Well, actually, there is because this is the last year and the end of the year, and I should prepare census and grand meetings. I'm
Uh-huh.
more busy.
Okay. Okay. With whom you are living?
I'm living with my husband and my two kids.
How are the things at home?
It's fine.
Okay. What is your last menstrual period, Mrs. Saida?
It was 2 weeks ago.
Okay. Are you taking any medicine to control the blood?
Yes, yes, I'm using Genera contraception.
For
The
how long
pills
you have been using?
for 4 years.
Okay. Uh, do you smoke, Mrs. Saida?
No,
Do you drink alcohol?
no,
Any drug for enjoyment?
no.
How this problem has affected your life, Mrs. Saida?
Well, doctor, it wakes me up from night, sleep at night, and this is I really need good sleep nowadays because I have very busy agenda at work, so I need to have good sleep.
What do you think, Mrs. Saida? What's going wrong with you?
I don't know, doctor, but really concern me. I don't know what is it. I am afraid
Do
it
you
could be
have
something
any worries
serious.
about it?
I'm afraid it could be something serious. I'm worried that I can't sleep.
I hope not be serious. Do you want me to do anything for you?
Yes, doctor, yes, I want to know what is this.
Okay, Mrs. Saida, can I examine you?
Sure, doctor. What you'll examine?
Okay, did anyone check your blood pressure outside?
Yes, they told me it's
How
normal.
you are breathing?
They told me
Okay,
it's normal.
pulse,
Yes,
pulse.
yes, as well.
Okay,
Told
okay.
me all
And
examination outside is normal.
I want to see your hands,
Okay,
any color change. Okay, any tenderness about your feet.
okay,
Okay, about the pulses,
okay.
capillary refill. Okay, have a seat, Mrs. Saida. Mrs.
Examination
Saida,
normal.
you are 25 years old and you have been suffering this foot problem with the color change and painful, especially at night when you are exposed to cold. Otherwise, your health is okay and you are happily living with your family, with two kids, and taking the contraceptive pills for the birth control. And you have this problem about 2 months, and you want to know what is the cause of this pain and color change of your feet. And you want some assessment. Anything else do you want to add it?
No, I covered it all.
Mrs. Saida, the condition what you have in called medical term Raynaud phenomena. Have you ever heard about it?
No.
Mrs. Saida, this is a condition when our body, the small pipes that supply our food, get narrowed because of exposure to the cold. I will give you a leaflet to study in detail about this condition. Actually, it's very common, and don't worry, it is not a serious condition. It comes in this age, and it can be controlled by medicine and by so many things. I will give you. I will inform you about that. Okay, first of all, I want to tell you to reduce your stress. This will also contribute in your problem. Have you got it, Mrs. Saida?
Really, doctor? So stress can bring it?
Yes, yes, it can bring it. Try to avoid the stress and try to keep it warm, where especially at night you can wear gloves to keep it warm. Okay, Mrs. Saida?
Okay, doctor, that's fine.
Try to do regular exercise to
Two
go
minutes
outside
left.
for 30 minutes.
2 minutes
And
left. Okay.
okay, Mrs. Saida.
Okay, doctor.
And also, I will give you a medicine called nifedipine. It will help your condition. You can take it for a few days to relieve your pain, and actually, it will improve the blood supply of the foot, and your pain will be relieved. Is it okay, Mrs. Saida?
Okay,
This is
doctor.
nifedipine, 5 milligram, 3 times in a day for a few days. After that, whenever you have any risk that you are going to expose yourself to cold, you can take at that time. Okay, Mrs. Saida?
Okay, doctor, that's fine.
We will arrange another meeting after 2-3 weeks to see how is the condition ongoing. Okay. In the meanwhile, if you have any concern at any time, if your condition is deteriorating, you can contact me at any time.
Okay, doctor. Doctor, is there any test to make sure it's nothing serious is going on?
Actually, no need to make sure about this condition. This is very clear, actually, nothing serious because you have no joint pain, no any rash or no any illness. And this condition is it with your one of your aunt also she has a similar condition. It's common, it runs in the families, but it's not life-threatening. Don't worry about that.
Okay.
No need to confirm any test.
Okay. Okay. Okay, doctor. Thank you. It will not affect these pills of contraception. It will not affect this condition.
Yes, I want to refer you to the gynecologist to change your medication as well because it can contribute also. I think
Okay.
better to take
Time
other
out.
than hormones.
This is a case of Raynaud phenomena. Your performance overall was very good. I will comment on your performance in bit details. You started smoothly, asking the patient, encouraging the patient to talk more about his problem. When asking a question whether the pain become better or worse, you ask, is it increasing or decreasing or the same? Increasing or decreasing are rather scientific terms. It's better to replace it by is it becoming better or becoming worse? This patient showed you the picture of of his foot. When you ask which area in your legs, sometimes better to ask the patient directly. Can I see your legs? Can you show me your legs? No need to wait for the examination to say, can I check you now? Just especially in the derma cases or any case that can have some manifestation in the skin. Okay, and you can proceed further on to the examination if there are some things you need to see more or you need to do more with the patient, like examine vascularity, like in this case. It's good that you ask about any pain in the joints because you are ruling out secondary Raynaud's phenomena. Secondary cause of Raynaud's phenomena, which is Raynaud's disease, connective tissue disease. You ask about the joints, you ask about skin rash. This is all is good. You can also ask about weight loss, about skin stiffness, about dry eye or dry mouth or any mouth ulcers. Yani any of those can suggest, but what you already asked, this is good that you ask about joint or rash. This is good, and this is appropriate to address to rule out any secondary cause of Raynaud's. Asking about hypertension, asking about diabetes is not relevant in this case because it cannot cause any it cannot cause Raynaud disease. It's not known to cause Raynaud disease unless if there is some medication that is taken that is known to cause Raynaud's disease, like beta blocker, known to make it worse. Yani propranolol can make it worse. Any beta blocker can make these symptoms worse. So you can simply ask, are you taking any medication regularly? You can easily find out if the patient's taking beta blocker, taking contraceptive pills, taking ergots, for example, on and off for migraine. All those can make symptoms of Raynaud worse. It's excellent that you ask about family history for this patient. You are ruling out whether this case is Raynaud's phenomena, which has a positive family history, or it's Raynaud's disease, which family history is unlikely. Also, it's excellent that you ask about the work and directly, straightforward, asking about stress at work. This is directly relevant to the Raynaud's because Raynaud's can be triggered also by stressful condition, which this patient actually have. And also another thing that makes you ask about work, whether this patient is dealing with vibrating tools. This actually also makes Raynaud's phenomena common. It's good that you ask about house as well to make sure there is no stresses. When asking more about psychosocial, asking about smoking is relevant, but alcohol is not directly relevant to Raynaud's phenomena. Asking about the contraception is good. You ask about the patient whether she is taking any medication for contraception. She is taking contraceptive pills, Genera, and this is also one of the risk factors. One of the things you didn't ask about, which is caffeine. Caffeine is also directly relevant to Raynaud's disease, can exacerbate the symptoms. Illicit drugs, which is you said drug for enjoyment, mainly amphetamine, can cause Raynaud's disease, Raynaud's phenomena. So this also relevant to ask about, which you already did. It's good that you ask how this symptom affect your life, how this condition has impact to your life. This is very important question because you will decide further on what to do with this patient depending on how this condition has impact on the patient's life. The examination done in this case is competent. You checked for the skin changes, you checked for ulcers, you checked for capillary refill by checking nail bed, and this is checking both vascularity and checking any signs of secondary Raynaud's, which is any capillaries in the nail fold. Checking the peripheral pulse is also competent. Of course, assessing this in online videos, online conversation will not absolutely be correct. But mentioning the things means that you remember them, and make sure that you check all the areas, anatomical areas, correct anatomical areas of the lower limb vessels to do it correctly in the exam. Of course, when I said the examination normal is at that time when the patient came to the examination room, the examination was normal. But showing you a picture before of Raynaud's typical Raynaud's phenomena in the toes. That's why I didn't bring it back in examination finding. You did very well concise summary at the end of the consultation, and this is very appropriate, mentioning only the important things that you need to summarize. This is a very good concise summary. You explained the condition in very simple terms. You checked first understanding of the patient, and then you make sure that he doesn't know what is diagnosed, and then you explained it to him, to her, and you also offered leaflet to read more. This is very good, and then you move directly to addressing the eyes and the concern, and the idea and the concern that the patient is having something serious. You reassured her. This is very good and smooth way of moving from one step to another in the management. Identifying that the stress is the cause of this condition and bringing it back in the management is excellent way, and this is a proper non-pharmacological advice given to the patient that is addressing the main problem. This is absolutely correct and excellent. And also advising the patient to keep it warm. This is a proper non-pharmacological advice. You also prescribe nifedipine with correct dosing and way to administrate and for how many days is going to be used. This is all correct. However, nifedipine has also 20 milligram dose that can be used once daily. This is modified released. Then smoothly you move to you told the patient when to follow him up to follow her, sorry, up within few weeks to see how things is going, and also you given her clear safety netting if things are becoming worse, if it's deteriorating condition. You need to come back again. You can consult me anytime, and you give her a chance to call you if she wants to come back. She can also come back if the symptoms become worse or deteriorating. The patient asks you a difficult question, which is any test that I can make sure that everything is fine. He's reminding you of investigation to be done in this case. Your opinion was respectful that there is for the time being no need to do investigation. However, if you do anti-nuclear antibody to make sure there is nothing going on, that you will not be blamed. That would be a good decision if you take to rule out also secondary Raynaud's, because if ANA is positive, that would suggest that there is underlying connective tissue disease, autoimmune disease. However, you choose not to do it and you justify it correctly, and you justify it confidently, and this is appropriate in the exam. If you ask to do anti-nuclear antibody in such a case, the SB was intending to flip a paper that ANA is negative. That would make your diagnosis sure that is correct. But I admire your way of justifying the why you don't want to do this test. You explained that he has a family history of such condition, and there are no underlying things that suggest that there is serious conditions going on or connective tissue disease. Also, the SB volunteered, and sometimes this happens in the exam, volunteered to point your attention that contraceptive pills can contribute to this condition. Actually, it does. It's one of the things that can contribute to Raynaud's phenomena. And when I remind you of this, you quickly remind yourself of that, and you managed it straight away by a word that it will not consume time for you before time is running out. You refer the patient to gynecology, while you could do something better. You could give her a leaflet to consider changing this type of medication, or she could stop it at the end of their this after this trip. She has her period after 2 weeks ago, so she can wait for another week and then use condom until we have further discussion about contraception. يعني referring to gynecology is not finding a contraception or choosing contraception is not an indication to refer to gynecology. You are competent to manage contraception in the family medicine clinic. So it's better maybe you would say that I will give you a leaflet for now to read more because we don't have time. We can have a later on discussion to discuss another method than the contraceptive pills because it can contribute to the condition and to make it worse. Overall, your performance was very good in this case. You addressed most of or almost all of the data gathering required, the management parts in all details. There are only just few things that I would like to share that you ask about some things that are irrelevant, like diabetes, like hypertension, like also asking about alcohol, which are not relevant in this case. And also when bringing the contraception, you didn't bring it, the contraceptive pills didn't bring it until the patient bring it to you back again, and when she bring it again, you suggested to refer to gynecology rather than offering to change it yourself, which you are fully competent to do. But overall, your performance was very good. I will give you a clear pass for this station. Good luck.